So, good evening, everyone. I want to apologize, Mr. President, that I'm going to break the common theme of babies, though I will talk about possibly the organ that has something to do with the conception process. So, my name is Tzameret Fuerst. I'm a proud Israeli American and citizen of the world with hopes and dreams to make a difference. It's an honor for me to stand here before you tonight in this 200-year-old institution with a rich past and vibrant present, intent on inspiring physicians, medical practitioners, and entrepreneurs such as myself to make a difference in our sphere of influence in science, technology, and medicine. I'm grateful to Paul Summerfield for finding me somehow on the internet and bringing me here to speak here before you tonight. About 2 months ago, I was sitting in an industry presentation, just as you are tonight. I was listening to one of the world's leading venture capitalists speaking about the field of medicine and technology. He is an industry veteran, a very distinguished gray-haired man, about 60 years of age, wearing a luxurious navy blue suit, and he was talking with authority and confidence about medical trends, macro medical trends, and specifically highlighting the opportunities in chronic disease, because we all live longer today. And by way of example, he says, you know, people no longer die of AIDS. AIDS is a chronic disease. My jaw dropped and stomach squirmed as he uttered those words. I sat quietly and patiently until he finished his presentation and watched a flurry of people come over to him and ask him a bunch of questions and left the room fulfilled. As he was about to pick up his briefcase and leave the room, I stopped him in his tracks. And I asked him to please look at the slide that I'm about to show you. This is a live snapshot taken about 3 months ago from the United Nations website, which you can Google right now. It's a live AIDS clock. And take very good care of what it says on the left-hand side. Every 12 seconds, someone contracts HIV. And every 16 seconds, someone dies of AIDS. There are 17 million orphans that remain due to this horrendous disease. The distinguished man was absolutely right. AIDS is a chronic disease, but in the wealthy corners of the globe where we're fortunate enough to have access to treatment. 2/3 of these deaths are in one particular region on the planet. It's in fact in 13 target countries in sub-Saharan Africa. And I'm here to tell you today that we can turn the tide on the pandemic of our generation. And don't take my word for it. Actually, you should listen to the chief scientist of the National Institute of Health of the United States, who for the first time in 30 years came out with a dramatic statement saying that we do have the scientific means to stop people from dying. This prompted President Obama to come out with a very bold statement, saying that for the first time in 30 years, we can achieve an AIDS-free generation. And he laid out a very detailed blueprint, but it's actually very simple. 3 principles to reach an AIDS-free generation. 1, access to treatment. 2, prevention of mother-to-child transmission, because an HIV-positive mother can give birth and raise an HIV-negative child. And 3, and this is where it gets interesting, scale up of voluntary medical male circumcision among adults in sub-Saharan Africa. This prompted 5 major partners: the United Nations, the United States government through its PEPFAR arm, the Bill and Melinda Gates Foundation, the World Health Organization, and the World Bank to come out with a very bold plan to accelerate access to voluntary medical male circumcision in these 13 target countries. And the goal is to reach 80% coverage, which translates to 20 million men in these 13 target countries. Now get this, if we can get 20 million men to get up and get circumcised, we will save 3.5 million lives and $16.5 billion in long-term healthcare costs at a cost of $1.5 billion. Now, that all sounds very good as a statistic, but in 6 years since this major plan was announced, we have reached 10%. So if we're going to reach 20 million men by the year 2015, we have 3 more years to reach 90%. Something really radical has to happen. And if you look at the circles here, the pie is the 20 million that is needed, and the red is how much has been accomplished to date. Now, I bet all the men in the room here are wondering, why is it so challenging to get a healthy man to come into a clinic and voluntarily go through a surgical procedure under local anesthesia to remove some excess foreskin tissue? Well, joking aside, there are actually 2 major challenges to getting this done. One is on the supply side. Africa lacks the resources to make this scale-up campaign happen. Let's just take Rwanda by way of example. Of about 10 million population, Rwanda has 582 physicians for the whole country. I'm not talking about surgeons, I'm just talking about physicians, period. So understandably, there's no way they're going to meet their goal to circumcise 2 million men by the year 2015. And on the other side, on the demand side, men don't want to go through a surgical procedure. They fear the blood, the injections, and loss of work. So I'm telling you now that there is a life-saving innovation that is at our disposal here and now, and I'm going to tell you about it. But rather than hearing it from me, I'm going to share with you a short video clip from BBC World News. Unfortunately, in the United Kingdom, you cannot access this video due to copyright issues, but this was actually a series, a 26-episode series broadcast on BBC World News. And the background is that the Bill and Melinda Gates Foundation asked the BBC to scour the planet to find the most innovative, groundbreaking healthcare technologies, particularly that impact the most vulnerable at-risk populations. Suffice it is to say that we were elected to be in the World Series premiere. So I'd like to take you back 4 years to the genesis of this project, because I think it's very important to where we are now, to understanding the perspective. A partner of mine attended a lecture in Israel, soliciting general surgeons and urologists, sort of telling them about this whole challenge to scale up adult male circumcision in Africa. And the idea was to solicit volunteers to come to Africa to lend their surgical skills and conduct these procedures. So at the end of the presentation, by show of hands, the doctors had to say, yes, I will join this trip, or no. So at the end of the presentation, nearly everyone raised their hands, except for one. One person walked out of that room and said, this is ridiculous. Africa is never going to meet their numbers with a surgical procedure. He calls upon my other partner, who is one of Israel's most brilliant inventors of medical devices, and literally on the phone, he invents the device. He came up with the medical principle of ischemic necrosis, which was based on prior work that he was doing on ischemic necrosis, which is stopping the flow of blood and oxygen to tissue. And it took 6 months of refinement then, speaking to the Bill and Melinda Gates Foundation, speaking to Africa, to nurses, to public health officials, to really understanding the settings. And as people in here may be product developers, it's so critical how you define that product brief in the very early stages to understand your target audience at the end. I'm sure that you can appreciate this as developers yourself. And I actually wrote that product brief about 3.5 years ago. And if the same phrasing remains today, how do you create a device that is safe, simple, scalable, and cost-saving for HIV prevention for resource-limited settings? Full stop. Once you understand that you're trying to target a low-cadre nurse wearing jeans and a t-shirt anywhere, anytime, with no electricity, that's how you develop your product. And that's actually what sets us apart from all the other techniques and innovations and devices that exist, because we were created specifically to help Africa scale up, period. In a nutshell, what we've created is the first and only device in the world for non-surgical adult male circumcision. Those who want to see it, I have it here later. Any volunteers? No. As you heard in the video, there's no needles, no knives, no blood, no suturing, no physicians, no hospitals needed. And actually, in 2 major nurse cohort studies conducted in Rwanda and Zimbabwe, both audited by the World Health Organization, the average time for a low cadre nurse to do the procedure is 4 minutes and 39 seconds on a procedure bed over the course of 2 visits. So that includes placement and removal, all in. It is 5 times faster than surgery, as confirmed by 2 randomized controlled trials, also audited by the World Health Organization. It is an FDA-cleared, CE mark certified, and we are in ISO 13485, which is the status for the medical devices. And we've been very fortunate to be acknowledged by major officials in the public health and philanthropic arena. Bill Gates actually included us in his annual philanthropy letter. And he talks about innovation, and he talks about PrePex specifically, and highlights that it reduces the pain involved and reduces the cost involved. And actually, Michel Sidibe, who is the Chief Executive Officer of the United Nations Arm for Global AIDS, the UNAIDS, he came to Rwanda, saw the procedure with his very own eyes, and released a press statement that is on the United Nations website, where he hails PrePex marks a revolution in the framework for accelerating HIV prevention. The outcomes. Don't even try to read this, but because we have physicians in the room, I did want to pull together all the major clinical evidence that exists. In nearly 8,000 procedures, actually today there are much more, but as far as clinical studies and pilots, there have been over 10 clinical studies, all audited by the World Health Organization, with the Bill and Melinda Gates Foundation, USAID, UNAIDS. Our criteria for doing the study, we are not the sponsors of the study. The government of Rwanda and the government in Zimbabwe were the studies, but the criteria was open book. Anyone who wants to see any case report form, it was open. So basically, it's probably one of the safest documented male circumcision techniques in the world for adults, with an adverse event of less than 0.5%, no serious adverse events. It's a very safe procedure. Most importantly, ladies and gentlemen, we can sit in the laboratory, we can sit in the clinician's office and talk about how great the device is, but if men are not going to step up and come forward to make it happen, we've achieved nothing. But what we've seen in these clinical studies is that men are flocking into the clinics and asking for PrePex by name. In fact, in Zimbabwe, while they were conducting their randomized control comparison study, after about 100 patients, clients as we say, the men started talking amongst themselves. And when they got, after about 100 patients, when they were randomized into the surgical arm, they declined participation in the study. And it took weeks to complete that RCT because men wanted PrePex. In Rwanda, these are my incredible friends, Dr. Leon, Dr. Jean-Paul, and Dr. Vincent, who have helped to create the PrePex Center of Excellence, which has become the regional training center for all of the 13 target countries. It's a train-the-trainer program to empower Africa to get this done on their own. Ladies and gentlemen, if we're going to rely on Western surgeons coming to Africa to lend their surgical skills, forget it. It's not going to happen. It's going to be expensive and it's going to take too much time. We want to empower Africa to do this scale up on their own because they can. Simply they can. And actually, I'm just going to go back for a second because this was the first sign. It was a temporary sign. And about 2 months ago, it became a permanent center for the PrePex Center of Excellence to have men also get the procedure done and train the trainer. So to me, that's a tremendous source of pride. And also in an unprecedented step, last year, following the incredible clinical evidence that was being observed in the countries, the United States government and the Bill and Melinda Gates Foundation decided to fund pilots. They actually asked all the target countries, what device would you like to pilot? Unanimous. Everyone asked to, bless you, everyone asked to test PrePex. And this was announced in the New York Times that these pilots will begin prior to what was the prerequisite before, is that you cannot do this without WHO pre-qualification. It was actually a precedent that it was authorized because of the importance of this procedure. And I think finally our most important milestone, which was really 3 years of work coming into this, the PEPFAR basically announced, Ambassador Eric P. Gooseby, who is the President Obama's appointment as the global ambassador for AIDS, he made a major announcement that we were the first and actually still the only device pre-qualified by the World Health Organization. And I cannot even begin to tell you the rigorous standards, clinical and regulatory, that we needed to abide by in order to get this very prestigious pre-qualification status. And that is really, it was really the sort of one step before, that's the final step, almost final step before the before the scale-up can begin. And now we're in discussions with the donors to agree upon a global public access price, which will enable the scale-up to be affordable and accessible for Africa. And that's where we are right now. So, as excited as I am, this is just the beginning. So I'm excited yet humble. And the scale-up hopefully will begin by the beginning of 2014 as we complete the pricing discussions and countries get trained and complete the pilots. But what I really wanted to talk, just to kind of wrap this up, is I began with talking about the rich past and the vibrant present of this institution. But now with the brains and skills and connections in this room, we all have an opportunity to shape the future. So if this story inspired you in any way, and if you have an idea for how we can move this mountain, please do approach me. We do have a major goal to achieve. Thank you. Good evening.